Thank you, Nehaji. Thank you, Hindi team. Now we are moving to our English session. Today is our 2051st day of continuous webinar. Thank you everyone for participating the webinar. Now we'll start with a prayer. Good evening and welcome once again. Today is our 2051st day of continuous webinar. Thank you all the faculties and participants for being with us. And today's our guest is Dr. Jayita Choudhary. Dr. Jayita, has she joined? Dr. Jayita? Okay, Dr. Jayita Choudhary. She is BHMS and LLM in Criminology and medical officer in Government of Haryana and published many research papers about genital socialization and generalized anxiety, substance abuse, and anxiety activity involved for medical camps, for charitable schools, and many papers she published, many seminars she attended, many papers and research papers she various news she's attended homeopathic speech in various news channels and many things about to say about Dr. Jayita. We are happy to invite you as a speaker of today. Dr. Jayita, you are welcome to IFPH forum. Thank you.
Hello, am I audible?
Audible, madam.
Okay. Very good evening, everyone. I would like to extend my thanks for this opportunity. This case is not just a case from the homeopathic point of view, but actually we were very fortunate enough, I should say, being a homeopathic doctor. Although I was there as an intern, overqualified intern, I should say. So I was very fortunate enough to witness such a case because the case was under State Forensics Lab, Karnal, Haryana, and I should say homeopathy has worked in such case like a miracle. So moving towards the case, the topic of my today's presentation is scope and application of homeopathy and internet-based cognitive behavioral therapy, that is ICBT, in juvenile offenders, a case of antisocial personality disorder using the ICENC personality questionnaire EPQ. So the following paper is not just a paper of how the homeopathy has worked and but also a psycholegal analysis of various juvenile cases that we come across in India. So, what is juvenile delinquency? Before going into the drug picture or the case conceptualization, I would just like to brief that the juvenile delinquency basically represents a very complex intersection of psychological and legal, social, and various environmental factors. Such environmental factors often contribute to the history of trauma that we usually find in such kind of drug picture or person, whether it be antisocial personality case or split personality case. So, among various psychological conditions associated with delinquent behavior, ASPD or antisocial personality disorder or the related conduct problems, especially in juvenile cases, are widely documented. And homeopathy, along with ICBT, I should say, has emerged as a very promising intervention, and that extends the traditional CBT through digital platforms and thus providing structured psychological treatment that is scalable and accessible and cost effective, given the fact that such kind of cases, it is very it is not mostly not safe to handle such cases. So the legal framework in India for juvenile justice has been established in the Care and Protection of Children's Act 2015, and it concerns and prioritizes the children under conflict of law with reformative approach, including presumption of innocence and best interest principle. But it needs to be quote best interest principle, because till date, 2015 till date, juvenile justice hasn't hold the board hasn't hold no proper authority for extensive evaluation of mental capacity or the neurodevelopmental conditions or the history of trauma or the ability to understand the consequences, lack of empathy or remorse in such kind of cases, or the proper medical intervention, including both allopathy or Ayush homeopathy. This is the reason that the rise of such heinous crimes and pervasive patterns like ASPD among the young youth, among the coming youth, has risen, especially I should say in states of Haryana and Punjab, where there is excessive cases of substance abuse to be found these days. So basically, this case study explores the application of homeopathy in the rehabilitation of a juvenile offender exhibiting ASPD traits, and the the person was associated with severe emotional dysregulation, impulsivity, and maladaptive cognitive patterns, and required structured, holistic, and psychological intervention. The present study was based on a 16-year-old male residing in a juvenile correction facility and in Haryana, and the approach of both the system of treatment was found to be much more effective. So the research objectives was to examine the personality traits and cognitive distortions of juvenile offenders using ISANG personality questionnaire, to evaluate the scope of individualized repertoire-based homeopathic medicines in ASPD, to evaluate the effectiveness of ICPT in managing antisocial personality traits and aggressive behavioral patterns, and further to explore the digital scope of digital therapy in juvenile correction rehabilitation centers through improvement in emotional regulation and empathy. So coming to the patient history, I won't go in detail on the hypothesis or the literature review, because this is not some research presentation. So going into the patient history, as I said earlier, the patient was a 16-year-old male, and he was residing in a juvenile detention center in Haryana. So the education was, he was dropped out after class 7th. The socioeconomic status was very poor, and residence in urban slum area, location in district Hisar, and the family structure was, the father had died when he was just an infant, and he had 4 unmarried elder sisters. And the presenting chief complaints included aggression, impulsivity, repeated theft, cruelty towards animals. I should quote here, he tried to rape a female dog in his locality 2 to 3 times. So this was there, and there was no remorse, and there was persistent aggression and violent behavior over the past 3-4 years. Frequent lying, frequent manipulation for personal gain, no remorse after harming others, repeated involvement in theft and vandalism and physical fights, and the cruelty towards animals has been reported by his teachers since childhood, and there was no disregard for rules both at home and school. So the history, if we dig further deep, the onset for the problematic behavior actually dated back when he was married 9 to 10 years of age, with gradual rise or escalation in severity and frequency of the most of the symptoms. And initially, the patient exhibited oppositional behaviors, including defiance towards authority figures, truancy, minor stealing, obviously lying also, And by age of 10 to 11 years, behaviors progressed to deliberate aggression, and it included bullying, peers, physical assault, destruction of property, and as the time went by, like in the coming 1 2 years, there was a marked increase in premeditated antisocial acts such as planned theft, group delinquency, and intimidation of the younger children. Hello, am I still audible? Hello, hello.
Yes, yes, audible, madam.
Okay, ma'am. Actually, I'm having a serious network problem, so I need to ask.
No,
Okay,
it's clear.
okay. Thank you, ma'am. So there was obviously the group delinquency, as I said, and harming the younger children. And the patient demonstrated severe emotional detachment because there was a lot of indifference from his mother's side, and because obviously the mother had to work a lot hard, and she has already faced previously a severe alcoholic father, because the father had died due to advanced cirrhosis, and he used to like beat her and sexually assaulted her regularly. And so the mother was obviously emotionally withdrawn, and there was lack of consistent supervision and emotional bonding between the mother and the child. And the peer group also included like delinquent adolescents engaged in substance abuse and petty crimes. So there was no evidence of psychotic symptoms, but poor impulse control and thrill seeking tendencies were prominent. And early childhood, as we go into the developmental history, the early childhood was marked by temper tantrums and disobedience and low frustration tolerance. And the history suggested of conduct disorder, which later obviously uh, given reason to the ASPD, and the academic difficulties and the eventual school dropout due to the disciplinary issues were further became the possible triggers, and the possible exposure to domestic conflict and inconsistent parenting practices added to it. So the reason for being brought into the juvenile custody was the juvenile was apprehended under provisions of Juvenile Justice Care and Protection Act following the involvement in group assault and a robbery case involving a local shopkeeper, use of threats and physical force to intimidate the victim. And there were prior record of multiple minor offenses also, including theft, vandalisms, and as usual, the authorities had reported that the juvenile had showed no remorse during questioning, which is why the ICBT was given, because such kind of cases are very much unsafe for therapists and doctors also. Even though he's only a child, and there was attempted to manipulate statements also, and shift blame to peers was identified as a primary instigator in the offense. So this is the mental status examination. Okay, obviously you can see the speech, and the mood is irritable, and affect is constricted, and perceptions, there were no hallucinations although, but the insight was very poor. So this is the vicious cycle which we often consider while handling such kinds of cases. And as you can see, just a second. Okay. The vicious cycle of the thoughts and the feelings and the behaviors that act like trigger, जैसे मतलब आग में घी डालने वाली बात हो, they often act as a trigger in such kind of distorted cognitive behavior cases, and it can include the early trauma or the socio-economic deprivation that the patient or the offender has faced all this time, and the distorted thought that I must dominate with no remorse. He didn't have any kind of remorse or empathy, and as per him, this was the best version that he thought he deserved. So the distorted thoughts the combined cognitive distortions attributed to the hostile attribution bias, leading to the conduct disorder in early childhood, and later into the antisocial traits, combining aggression and impulsivity, further developing into the criminal behavior, due to which he was assessed under juvenile justice intervention. And later, the psychological profiling like EPQ, MSc, and later all the tools were done, and the modules of ICBT and holistic approach of homeopathy was further implemented, which further aided to the cognitive restructuring and emotional regulation, plus lowering the mental symptoms with reduced aggression and improved the empathy uh, with less relapses. But obviously, when you present a research paper, it is not the findings, or it is not just the positive things that we have found in our case, but also we need to consider the limitations also. And as the case is already a typical psychiatric case, so the limitations were, I should say here, one of the limitations was there were less relapses, but not what we expected. And the resistance from the patient has reduced, but still I could say not what we expected. But overall, there was a lowered recidivism risk. So just a second. So this is the case conceptualization, and all these things I've already discussed, and further moving to the homeopathic approach. These are the short-term goals and long-term goals, obviously, that we consider while giving the ICBT, along with, because homeopathy or the ICBT, that is cognitive and behavioral therapy, cannot just be given as a standalone treatment in such cases. Although the patient has shown a very significant improvement, but still, the short-term goals and long-term goals with the juvenile offenders are like a need of hour. So this was the basic ICBT that was given to the patient, like psychoeducation. Initially, normal cases may it mostly takes a week only. Patient, but in such kind of cases, psychiatric patient, we for that he was able to of his actions. So since stramonium, so as you can see the further as you can see the essence of the stramonium. Basically, stramonium is a very primarily neuropsychiatric remedy. It's a very deep acting remedy, so it should be given very cautiously, and it is not to be repeated. Mostly it is compared with belladonna and hyoscyamus in case of like fever, when given fever or stammering speech. But due to its intense mental symptoms, including intense disturbances in behavior, impulse control, fear, and aggression, it was perfectly mapped for the patient, and the core mental and behavioral picture mostly included the violence and the aggression, the sudden explosive anger with violent outburst, tendency towards cruelty and destructiveness without any remorse, and no remorse while harming others, and the antisocial traits obviously included, as I said earlier or mentioned earlier, that disregard for social norms, He used to use abusive language towards his mother. But there was a thing also that there were two things going simultaneously with each other. एक जगह ये था that he wanted that nurturing affection from his mother, but because he was unable to have it, the violence was the compensatory mechanism or the compensatory action the patient or the offender inflicted himself towards that further led him into acting, that further led him to act in such kinds of terror or violent nature. So there was manipulation and deceitful behavior, and there was intense fear of darkness and being alone. And he wanted to cling to people and seek company, but yet behaved violently towards them. Now, this is also a symptom that we mostly find in split personality, but this duality is a hallmark here as a prescribing feature, not only for the ASPD patient, but also for stramonium. So the delusions were there, and the impulse discontrol, like sudden urge to hit or bite or destroy, run away or escape, and very, very poor frustration tolerance. And this also was a marked symptom in the patient, and the history of bedwetting and early behavioral dysregulation involving empathy, no empathy traits, and the emotional state of the patient alternated between the rage and the terror, or you can say the emotional instability or the no guilt oriented or excitement or withdrawal symptoms. So the physical generals were also prominent, like dilated pupils, constant staring look, and this restlessness with jerky movements, and heat aggravation, and overall the, the overall after the repertorization, the essence of stramonium was further evaluated, and the combination of the violence, the fear combination, the violence and the fear combination, not just cold, not just criminality, but the cold. Well, he was such a cold-hearted patient or cold-hearted personality that was already the essence of the stramonium medicine or the dhatura. And the psychotic features included hallucinations, sudden impulsive aggression, rather than the calculated crime. Now, impulsivity is something that is different rather than those offenders who commit crime in a very calculated way. So, this is also a hallmark of the drug stramonium, the homeopathic drug stramonium, and the history of trauma further added to the pathology or the development of the pathology of the patient. So this was a repertorization done, and the medicine was repeated in was given in 1M potency because it's a very it's a medicine that needs to be very cautiously used because it's very deep acting medicine, especially on the mental sphere, and it was repeated once every 15 days till 6 months. Further follow-ups till the 6 months there were like very much improvement. Further follow-ups we were unable to take. However, when we visited later, the patient was showing a lot of I should say marked improvement, like cognitive changes. There were a lot of cognitive changes in the cognitive distortions that he had it earlier, and there were increased awareness of consequences of his behavior, and there were reduction in the hostile attribution bias, improved ability to identify irrational thoughts. There was a calculated manner of emotional regulation and reduced anger intensity and improved frustration tolerance. And the emotional awareness was one of the most notable changes was the patient's or the offenders or the participants' ability to recognize the consequences of his actions. So initially the behavior appeared driven by dominance and immediate gratification, which is also a hallmark symptom of stramonium, or you can say the essence of the medicine. But the post-intervention behaviors, like we have taken all the pre and the post scores, because this paper was part of my thesis of my LLM. So the post-intervention observation indicated increased reflective thinking and reduced hostility. These findings align with with various cognitive behavioral theories, if I can add to it, and which emphasize the role of maladaptive thought patterns in sustaining such kinds of antisocial behavior. So there were also regression in a reduction in aggression incidents, causing harm towards others, especially people who are younger than him, and improve compliance with institutional rules, and low defiance and increased cooperation in group activities, because social skills training is also a part of rehabilitation program with such kind of patients or offenders, you can say. So this is the EPQ, I think, personality questionnaire scores. And okay, thank you. So these are the behavioral scores: aggression, impulsivity, empathy, and these are the ANOVA results. There is a significant improvement, as you can see in the ANOVA also. So now this is also showing a very good improvement, significant improved emotional regulation, because the variable pre-intervention and mean post-intervention mean differences, or the scores, shows already a significant reduction in psychotism and neuroticism levels. Homeopathic, after giving the homeopathic medicine and along with the ICBT, that it has shown a significant improvement in the distortions, in the cognitive distortions, and the behavioral control among the juvenile offender, thus providing further improvements in patients' daily functioning life, which was our sole motive. The magnitude of change across the behavioral domains indicated a strong treatment responsiveness, both the treatment responsiveness and the reduction in the psychotism and aggression, as you can see, minus 2.6 and minus 3, reflected improvement in impulse regulation and hostility modulation. So further, if I consider the Cohen's d also, the Cohen's d value exceeded 0.8, indicating large clinical effect, particularly relevant in forensic rehabilitation, where behavioral change is the primary, I should say, outcome measure. And given the fact that it was a single case design, because I think as a homeopathic doctor, I was fortunate enough that it's a once in a lifetime opportunity to see such kinds of cases in correctional rehabilitation center. So the inferential statistics such as repeated measures, ANOVA, are interpreted further very cautiously. And the observed reduction in the scores, along with large effect size of Cohen's d, suggested that clinically meaningful improvement rather than statistically generalizable findings have given a very positive outlook towards such case of ASPD. And the present case demonstrated the risk of conflating manipulative behavior with cognitive maturity. Now, this is something that through our research can aid to the judicial review of the Care and Protection Act of Juvenile Act of 2015. And the psychological assessments such as EPQ and the structured ICBT response patterns suggested neurodevelopmental immaturity despite apparent behavioral planning, thereby challenging the reliability of Section 15 transfer decisions under JJ Act. Because if you are aware of the Act, you might have been knowing that till date there has been no proper provisions of extensive psychological evaluations of juvenile cases. But such kind of research or such kinds of interventions which we can do as a therapist or as a consultant, it can aid to the judicial review. Thus, I think I can say मतलब इस तरह की जो टेप मतलब जो चीजें होती हैं वो further it can contribute to the fact that can avoid or that can stop the juvenile cases turning into hardcore criminals. So the action, thus indicating a third wave intervention, it can be ACT. So this is the graph, and the constitution treatment given through homeopathy, because homeopathic remedies are based on individuals' totality of symptoms, comprising mental and emotional and physical, rather than targeting a diagnosis alone. These principles are rooted in the principles are rooted and introduced by Dr. Samuel Hahnemann. And this approach aims to address deep-seated personality patterns and behavioral tendencies. And for typical conditions like ASPD, and where enduring maladaptive traits like impulsivity, lack of empathy, deceitfulness, and aggression are central. Thus, constitutional prescribing attempts to modify underlying personality disposition and improve impulse control, relapses, and emotional regulation with enhancement in, I can say, moral reasoning and social adaptability. So, homeopathy thus interprets ASPD through miasmatic theory and mental generals and developmental history, including trauma, neglect, environmental disruption, thus providing stabilization and holistic, I should say, holistic improvement in such kind of cases. So the ANOVA and the Cohensdy analysis demonstrated that homeopathy as a holistic treatment significantly reduced antisocial behavioral scores, and the mean behavioral score decreased, indicating substantial therapeutic improvement. And so in further going into the discussion or the conclusion, the findings of the present case indicated that homeopathy can play a very meaningful role in addressing antisocial tendencies among juvenile offenders. As I also said earlier, one of the notable changes was the participant's ability to recognize the consequences of his action. And this suggests that homeopathy and ICBT can be maybe particularly suitable for adolescents who are comfortable with digital environments, who show a very aggressive behavior in such kinds of rehabilitation setups, but it cannot be implemented as standalone therapy. None of them. However, it is important to interpret these findings cautiously Being a single case study, the results cannot be generalized. The limitations needs to be further evaluated, and because it comprised of small sample size, short duration of intervention, and limited follow-up data. So the further research should include longitudinal studies, including homeopathic approach to examine long-term behavioral changes, reduction in criminal recidivism outcomes, because single case statistical overclaims ANOVA plus p values are not basically methodologically valid with sample size 1. Therefore it needs to be reframed as indicative statistical trends, and the legal RNN model, as I suggested, is need of hour to reduce recidivism, improve emotional regulation and decision making, and develop legal and social identity. And the further amendments needs to include standardized forensic psychological protocols which can reduce arbitration in juvenile justice decisions, family therapy enforcements, neurodevelopmental based legal standards, specialized juvenile forensic units, thus strengthening aftercare and monitoring and aligning law system with modern psychological and Ayush system of medicine. So such positive changes through holistic treatments, including homeopathy and ICBT, brought in such typical psychiatric case study can be a fruitful contribution to the judicial review, thus aiding to such kinds of juvenile offenders and helping them not turn into hardcore criminals. So the ethical guidelines and patient's identity was confidential, informed consent was taken, and there is no existing conflict of interest related to the case study or the tools used. So thank you so much.
Thank you, doctor.
Thank you, ma'am.
We have 15 minutes more. So if you have any questions, the participants, if you have any question. Doctor?
Yes, ma'am.
I think I will not get any more questions from us. We have 10 minutes, 10-15 minutes. So if you can continue up to the, I think you have more slides, right?
No, ma'am, this was the last slide. Because it's actually case study, it's actually a research paper that has already been
Really?
published, already that I've compiled in PPT.
Okay.
Doctor, what was the outcome about your treatment in such cases? Juvenile offenders.
So juvenile case, this is the only case that I have come through so far.
Dr. Jayita?
Yes, ma'am. Am I audible?
Yes, audible, please.
Okay, thank you. So this is, sir, as I said earlier, I was very much fortunate enough to come through this case, and this is a single case that I've come across, obviously. So there were a lot of changes in the cognitive distortions, because not just homeopathy, but CBT also, as you might be familiar, it is meant to channelize the negative thoughts into the positive ones. So there were a lot of distortions, as I said earlier, in the patient, but the changes in the patient's especially his awareness towards the consequences, what he was doing. Because पहले उसे ऐसा लग रहा था that whatever I'm doing is fine and this is the version I deserve. But later he tried to believe, he was motivated with the idea कि नहीं, I need to change myself. And both the treatments were given to him simultaneously, and the ICBT was lasted for 8 weeks, 8 to 9 weeks, and the homeopathic treatment was given to the patient almost 6 months. So we were not like able to take good follow-ups after that, because I live in Gurgaon. The patient is under state forensic lab Karnal, but the director in charge, who was already taking care of that patient, he later let me know that patient के अंदर बहुत अच्छे changes हुए हैं, and he has improved social skills. Because अगर extrovert और introversion की बात हो, the patient was not, basically the patient was introvert, but the actions he did made him extrovert. So it can be a dual personality, it can be a split personality, but he has learned good social skills, and there was very reduced anger in him. क्योंकि पहले भी जब हम उनसे बात करते थे, the treatment and everything was like given on digital platforms and under strict supervisions. तो जब हम उससे पहले ही बात करते थे, there was no direct eye contact, and he literally showed hostile kind of behavior. But abhi the patient was ready to talk to everyone, and there were good changes, I should say. अपनी mother के साथ उसका जो एक रहा है history, use of abusive words, not listening to her. Now he talks to his mother, and he also talks to his elder sisters, and there are improvements. He has started taking responsibility, not just of himself, but also he thinks of his family. Halaki, I should say he's a very, he's very, I should say he's not of that age, because 16 years, I don't think is that much high age, but still he is unable to understand the role of being the role of being a responsible son in the family, because he is the only male in the family. So I think these changes were far better.
Okay, what about the number of cases in your institutions in Haryana, government institutions? How many institutions are there? What about the patient status?
Patients like psychiatric cases or
general as well as psychiatric cases?
The psychiatric cases, अगर हम देखें, sir, I work basically in GHD, and this case was part of my LLM thesis. So I had to move for a few days from Gurgaon to Karnal. So psychiatric cases अगर देखा जाए तो हमारे गुड़गांव में जो citizen de-addiction center है, there are a lot of cases of substance abuse. हालांकि there also we have given homeopathic medicines. I have personally worked with such kind of cases, and to be very frank, the relapse, because substance abuse में सबसे important होता है the severity or the relapses. तो relapses में काफी improvement मिला है. Medicines including Nux vomica and hyoscyamus, belladonna. These medicines have worked wonder in substance abuse cases, and substance abuse cases are very much related or correlated, or I can say goes side by side or simultaneously with such kind of psychiatric cases or psychological cases also. So there are improvements seen in juvenile cases.
How many institutions are in the government section in Haryana? Homeopathy institutions there?
Homeopathic institutions or psychiatric institutions?
No. How many institutions are there in Haryana and government sector or homeopathy?
Sir, I can say only about Gurgaon only, क्योंकि गुड़गांव में तो हमारे like.
Why? Yeah, this is when you are working in the department, government of Haryana government. Then why you are not aware of that?
Sir, Haryana government में sir Gurgaon district में I can say there are.
I am not aware of district or institution.
No, sir, I am very sorry. I don't know about the complete case.
In Kerala, we have around 700 dispensaries and 34 hospitals.
No, sir, I am actually
total more than 1,000 institutions in government sector.
Sir,
We know that.
I don't know about the complete state, but under NHM and state and HKRN.
Yeah.
In Gurgaon, we have 15 to 16 dispensaries, CSCs, PSCs, where homeopathic consultants or homeopathic medical officers are working. And besides, if you talk about the psychiatric institutions, there are 2 psychiatric institutions running under civil hospital under CMO Gurgaon. One is of the substance abuse, and other comprises of the
Anyway, kindly collect the basic information so you can exchange with others, especially attending Zoom seminars, quite natural. So you will be asked those questions.
I'm really sorry, sir, but I'll let you know the complete infographics of the how many PSCs and CSCs are running in the whole state. But I can tell about
the patient output. How many patients are you treating in a year?
Sir,
in Kerala, it's around 140 lakhs, 1.40 crores in Kerala last year. That is statistics in government institutions.
That is a very good figure, sir.
So it's highly important to get some information from you.
Patients' opinion here, it's actually very good. The public opinion about the homeopathy is very good. In fact, my major working area is in GHD, Government Homeopathic Dispensary, that comes under Tehsil Pataudi, and daily हमारे यहाँ भी sir almost 70-100 cases आते हैं. हालांकि sir, I should say I am not able to give or take complete case history of such kind of patient because timing का थोड़ा सा रहता है. But still, जब अच्छे cases आते हैं like Parkinson's and PCOS, तो obviously we go for the case consideration also.
Yes. You have got the LLM criminology, so definitely you are expected to do more in this case. Is very important one because as the India becomes a developed country, this is become an integral part of the medical treatment. Anyway, thank you for presentation. Dr. Ganesh joined us.
Yes.
Thank you, sir. Can you open the camera now? Now there is no need to share the screen, right? So we can see you.
Sir, ma'am, actually, I don't know. 1 minute.
Yes, so you just try to. Yes.
Actually, I'm thinking. Sir, just hold on. अगर मैं screen on करूँगी.
On the left extreme, you can see the audio. Then the second, you can see the video. Then you just click on the video. You can see the your face on the screen, so that everything will be fine for you.
Which one it is? The host has asked you to start your video. Cut तो नहीं जाएगा ना ये? Okay.
Yes, the thing.
Now
yes, yes, doctor, the presentation was extremely good. But the thing is that we are a group of people who the purpose of this organization or this union is to promote homeopathy among public. But the thing is that the doctors, you are also working in some other organization. But why this is happening? Because you people are not looking at the other part of the other part of India, where homeopathy, how homeopathy is propagated and how homeopathy is developing. You know, here in Kerala, we have different organizations, and almost these organizations are working hard to take homeopathy at the government sector. And here we have a homeopathic directorate, which is under the government of Aish also. But the thing is that it is all the doctors here are permanent doctors. They are not part-timers, just as Aish doctors. But we have more than 46 government hospitals and where a lot of admissions are going on. And we have more than thousands of homeopathic dispensaries where 100 to 200 patients are consulted. And we have different departments, particularly for infertility, for educational purpose, looking at the age group, looking at puberty children, all those type, a lot of counseling centers and everything. But you are working with the government organization also. I know that even though you people need to press the government to start permanent homeopathic dispensary, permanent posts for creating more posts in government sector. Not simply some people are appointed for contract basis. That's a bad thing. Why the organization you are part of the states are not working in that way? It is primarily the duty of each and every homeopath to take this thing as a challenge. Most of some of our doctors were put in the jail for a long time. Even I was there in the central jail of Kerala for 15 days for a strike for the purpose of achieving the target of homeopathy or highlighting the promotion of homeopathy. So this kind of hard work is necessary to take homeopathy to higher level. So you being a criminologist as well as an LLB and not LLM.
No, not LLB, sir. LLM.
LLM. That's why. That's why. But you were silent. You're just trying to get your money and going back to home and enjoy your life. But that's not sir. That's not the way. To give you are taking everything from homeopathy and all these things. But you people have the dedication and determination to give something back to homeopathy. That's what I would like to say. So kindly try to become a part of your organization and work for that, because you are a person who can directly contact with the ministry at your state and ask them and to come to in Kerala and see how homeopathy is working here, how the Department of Homeopathy is working here. So that you people can demand at least some 200 dispensaries from the very next year, because I know
Thank you, Dr.
the government at
Now,
the
I think
DNI is in your party. So
No,
that's
sir. Actually, whatever you are saying, it has a deep meaning because we don't have 200 dispensaries in Haryana. Because in Gurgaon only we have like 14 to 16 dispensaries comprising GHT, CHC, HWC, and PSC. So it is very low, I should say. In fact, we don't have a proper government college also. We have a private college only in all state of Haryana. That is JR Kisan.
actually, doctor, take it positively. Actually, we got I didn't met any homeo doctor with masters in law. So we got such a lawyer in for IFPH or for the homeopathy. That's why we are encouraging you to do something.
No, ma'am, I understand.
Take it in a positive way.
No, I am taking in a very good, positive way only, ma'am.
Yeah, we need you for to take law decisions for your suggestions. So we got such a doctor, and now we got a special person.
So I think after Bonnie Hassan, we have another criminologist. Bonnie Hassan has
Yeah.
been
Bonnie
the
Hassan.
second person, I think.
Yeah, criminologist with the masters. Thank you so much, doctor, for your presence here, and I am inviting Dr. Ram Parvesha sir for giving vote of thanks to Dr. Jayita.
Jayita Choudhary. So thank you, Dr. Anjani, and everyone. Namaskar, Manoj ji, Dr. So
Dr. Jayita,
very, very
are you
thanks
here?
and
Yes, ma'am, I'm here. Actually, the network is very
Okay.
proper here, ma'am. Sorry, ma'am. I'm really sorry. I'm here, ma'am.
video. Please, your congratulations, Dr. Jayita Choudhary.
Thank you.
Choudhary.
Okay, sir.
Jayita Choudhary, BHMS plus LLM. Very important degree in homeopathic science. So, ICBT in juvenile offenders.
Yes, sir.
So, very good described. And role of homeopathy. Role of homeopathy, the important role of homeopathy, juvenile offenders. Suppression, anger suppression, anxiety, and grief. But past history and family history is important.
Yes, sir. Yes.
Or plus during pregnancy, mother is take the diet and thinking. So, according to homeopathic, role of miasmatic, important role, miasmatic. So, juvenile, first Sora role the anxiety, and second psychotic, impulsive, hidden behavior, and or third syphilis, disturbedness nature. So homeopathic is a very important juvenile offender. So very thanks, Dr. Jayita Choudhary, BHMS plus LLMB, IFPH is the very thanks. Whole IFPH team is the very thanks. Thank you again presentation.
Thank you so much. Thank you, everyone. Thank you, Dr. Jayita, once again. And
thank you, ma'am. Thank you, sir. If there is anything, any improvement, anyone would like to suggest in this research paper, I would be really grateful. Please, I really need all your inputs. If there is any input you can give that can further contribute to my research paper, because this is an ongoing paper, and I'm still in process of getting much more psychiatric conditions in rehabilitation correctional facilities. So your inputs will be valuable for me.
It is better to give your number here. If anyone have any suggestion, they will contact you directly, because we have to move to the another session now in Malayalam language. Now it is the time to end the English session.
Okay, ma'am. Thank you so much.
If anyone have any suggestion about her research paper, you can contact directly. Thank you so much, Doctor, and thank you all the participants. Now I am handing over the session to Dr. Manoj. Thank you and good night, everyone. See you the same time tomorrow.